Professor Mahesh Verma is going to talk about different school-based programs in the Delhi and more widely within India. Mahesh.
Could I have the first slide? Raman, while you were you asked me to participate in this webinar, being the dental school here, in my work as a dean, and we had a very unique school health program, mobile dental clinic program, as well as which was integrated later into school health program. I mean, I was expected to answer 4 questions, and I would restrict my presentation to answering these 4 questions. And the first question was that how could a dental school engage in school-based dental toothbrushing? And in India, we, as you all know, that we have a huge number of dental schools. We have nearly 315 dental schools, and almost 26,000 students they pass out from these schools, for undergraduate level. And we have a very intense public health training program embedded in the school curriculum, and where they are exposed to preventive dentistry in 3rd year as a part of public health dentistry subject, and also in 4th year, along with other clinical subjects like pediatric dentistry, orthodontics, and other specialties. And they are expected, these students are expected that they learn while they are posted in a public health dentistry posting in the dental college, or during the camps or adopted schools, as part of their training. They learn the plaque control interventions, how they can measure and how they can practice these different indices in plaque control and oral hygiene indices. And they also, during their training, they also expected to learn to develop different health education materials like posters, models, infographics, and other various different innovative games and working models, so as to not only influence and educate the adults, but primarily, basically, the school children. And also, it's also expected that every dental school in India would adapt at least two schools as part of as a part of their training. So if it's mandatory that every dental college institution will have attachment with at least 2 schools. And I know that most of the dental schools have many more schools where these students are posted not only for training, but even otherwise, because somewhere we feel that the school health programs, especially school dental health program, should be taught to the dental graduates, because eventually they must practice this at when they pass out from these dental schools. Next slide, please. So school-based health programs in India already have, we have a midday meal scheme. Most of the states across the country have a midday meals scheme, but I think there are very few states where toothbrushing is mandatory. It's a part of these these school-based health programs. But they are taught hand washing, and they are provided meals. And I think it would be ideal, like what Hami said, what they practice in Mexico, that they wash the hands, they eat the meals, and afterwards, which followed by brushing. So this component is primarily lacking, and I think as it has happened in Mexico and in Brazil, that some of these companies, as a part of CSR activities or even otherwise, promoting this effort, I think support from industries really needed, because they could provide the kits and they could provide the materials and toothpaste for carrying out this, because this is a humongous amount of work, which is especially if all the schools have to be involved in every state. Next slide, please. So some of the examples from India, I want to share with you that in India, I think the Delhi state is doing rather well, especially when it comes to health standards. And there is a very robust school health scheme in Delhi, and this scheme is applicable to all the Delhi government schools, and also some of these schools are although private, but they're aided by aided by the government. So there are nearly 1,600,000 school children in these in these schools where school health scheme is already being there. And there is another program which is called National Oral Health Program, NOHP, and which is of course not the central, which is not a state government program, because these schools are under the state government, but the central government has a National Health Oral Program wherein they have done many endeavors, and one of this is that they have developed a training manual for all the teachers, so that these teachers, they are trained, and that these teachers these teachers in turn, they teach the brushing and teach the dental health education to school children. And we have a very very long, very old Bright Smile, Bright Future program by Colgate, where they have been providing through the Indian Dental Association, the free kits and other oral health education material, charts, model, brushes, all those things for dental screening. And I think it is expected that every branch, we have nearly 500 branches of Indian Dental Association spread all over the country, and every branch is given some money every year, and that money is supposed to be used for this program called Bright Smile and Bright Futures. Next slide, please. Next slide. We also have a very strong Indian Association of Public Health Dentists. We have most of the schools are running postgraduate program in public health dentistry, and they have adopted November 7th as a National Toothbrushing Day. So there is, there's a huge awareness that this toothbrushing must be carried out by school children in the schools. And not only that, not only on this day, 7th of November, which is used, as a just to awaken, just to sensitize the school children all over the country, that for awareness about brushing, but also other health education sessions, advertisement for promotion of oral hygiene, and health exhibition, etc. Next slide. Now, what is the advantage our dental students schools they visit? Why, as I think we've seen it happening in Mexico, we have seen it happening in Scotland and in Brazil, that because dental students are the foundation of dental education, because these students, not only when they come out, not only they become faculty, but they also teach their patients. And so they can, if they are exposed to this, I think they can contribute to advocacy, participation in community-based programs, and eventually research, when they pass out and practice dentistry. And only thing that they need, initially they need some leadership. They need to be mentored. They need to be assisted. They need to be handheld, and so that they can, they can ingrain these lifelong skills. And because this will make their education not only more enriching, but also because what has been seen in the past, that although we study preventive dentistry in dental school, but when we pass out, we do not practice preventive dentistry, especially the large number of practitioners. They focus more on restorations, and somehow the preventive dentistry takes a backseat. And I think dental students, while they are, if they are part of the toothbrushing campaign in the schools, I think they are accepted better, because they can really come down to that level and they can break the barriers. And if they are well oriented, I think they can really look after the children's needs all they need is that they need a little bit of mentoring, and so that they achieve these, these skills for lifelong, and which would help them in different situations. Because every country, there's a diverse diverse population, diverse distribution. There are say India also, we have far-flung areas, we have rural, semi-urban, urban, we have metros, and we have areas where healthcare, forget about dental care, even healthcare is not accessible. So I think the students, dental students especially, they also need to be oriented, about this, and they also need to be trained so that they can look after all kinds of dental needs to all sections of society. Next. Another example from Delhi, as I told you that in our Maulana Azad Institute of Dental Sciences, we were the first one who started mobile dental clinic project, and this was under the National Health Mission. We had a program from central government where state governments are assisted for health mission in urban areas, and then they came up in the rural areas, National Rural Health Mission. Later it was called a National Health Mission, and they were supporting, funding, providing human resource, providing technology, so that accessible, affordable, and quality oral health care could be provided to the vulnerable population. So under this program, we started this first mobile dental clinic project, which was more like a pilot project. And in this, we had about 6 mobile clinics. And this was started in 2014. And using these mobile clinics, we were because Delhi is a big city, and we still have certain rural areas or areas which is not the main part of the city, which is in the outskirts of the city. So 2 districts of these of the city were being served by through this mobile dental clinic project, and this project was later then also integrated with the school health scheme, which was already in place. And using this while mobile dental clinic and school health scheme, we've covered about 23,000 school children, which were educated and screened. And also now recently we have started a national social NSS, we call it National Social Service Scheme at the institution at the dental school. And the entire objective of this program also is to provide promotive and preventive activities in the schools, colleges, and universities. So this is slightly different, not a typical public health dentistry activity, conventional public health dentistry, but it is mainly focusing on schools, colleges, and universities. And this program, as it is recently started, so we just covered about 750 students studying in different educational institutions under this program. Next. So, basically giving you a little flavor that how this is happening in, all these things are happening in India. But I think, like Mexico, we need also somewhere some legislation or some system where it becomes a mandatory that school children, when they have because there's a midday meal scheme going on in most of the states across the country, that there they are exposed to hand hygiene, and they are given midday meal, and after that followed by mandatory toothbrushing. Thank you.
Mahesh, thank you very much. That's really interesting what's happening in India. I think we're getting the picture that, and the message I think we're trying to convey is not to have toothbrushing schemes, fluoride varnish schemes as parallel programs, just something that is introduced and by a dental group, and then they leave, and that's what they do. But to build toothbrushing into the life of a school, into a daily habit of a school, and actually part of the education experience. Every parent tries to teach their child at a young age to brush their teeth. It's a learned behavior. And if schools can reinforce that as part of their mission, then this is going to be very important. So I was quite interested that dental schools have that exposure in their undergraduate world to go to schools and begin to understand the culture of a school, to understand how to engage. And that's mandatory from the Dental Council for India?
Yes, mandatory, because there is a curriculum, during third year of their BDS program, they have, there's certain requirements, there's certain work requirements which they have to undergo, before when they are allowed to sit in the exam. So I think it's like competencies. They have to develop these competencies.